Familia. What a pleasure to see you here. Today, it's an amazing day. As we know, sadly, we end up using a lot of medications in our lives. You can have diabetes, you maybe have a headache. Then we're talking about insulin, we're talking about those amazing pills that actually makes you feel better. And sometimes, actually, they cure you, and it's not just a medical band-aid. As we know, all of them have a cost and they have a reason why they are there, and they, most importantly, there's options for us to use them or not. Then as part of this, I have an amazing friend that has been in tune with how to better manage and making sure that all of us are taking care of ourselves and having fun and learning about medicine, and most importantly, how to improve our system and create solutions. And he created a beautiful article, and I'm going to showcase it right now. You can actually see it. It's there for everybody, regarding the potential medical Part D savings. And this is important for all of us, not just for people that are sick, but for anybody that actually has a human beating heart. We will all need these medications, and the efforts that we have, sometimes they go, that money goes somewhere else instead of actually coming back to our communities, coming back to the prices of the medications. And that's why I'm inviting my amazing friend, Dr. Hussain Lalani here. How are you, señor?
Hola, amigo. Dr. Shapiro, it's great to see you. Thanks for having me.
Full disclosure, with Dr. Lalani, I actually met him and worked with him for probably a year and a half during crazy times. And I have met him only once in person, and that was an amazing meeting with other people. And Dr. Lalani, please, who you are, where you are, and what do you do?
Yes, of course. Welcome, everyone. My name is Hussain Lalani. I'm a primary care physician at Brigham and Women's Hospital in Boston. And I'm also a research fellow at our research group, which is called Portal, the Program on Regulation, Therapeutics, and Law. It's a lot of words, but essentially we're a group of researchers, doctors, lawyers, public health experts, and we try to understand why drugs are so expensive and to evaluate policies and solutions to lower the cost of prescription drugs.
That's quite the amazing gateway for your article, and I'm going to put it here on our side. Tell me about it. Why did you end up doing this? Why the group decided to actually go the route? What's the problem?
You know, Dr. Shapiro, I care for a lot of patients in my primary care clinic, and many of them struggle to afford their prescription drugs. And it breaks my heart that they are suffering so much. And, you know, there's been a number of attempts to try and lower drug prices. And the Mark Cuban Cost Plus Drugs Company is one of the latest attempts at doing that. So we thought, well, why don't we try to better understand how much impact can this new company actually have, and who does it help? So that's what led us to do this study.
That's amazing. And, you know, what options did we have before? You know, for someone that is just entering this conversation, why is this important for us?
Absolutely. You know, when you go to the pharmacy to pick up your prescription drug, the first thing they're going to ask you is do you have insurance? And if you do, they will take that information and that will determine how much you actually are asked to pay out of pocket for that medication. Sometimes there's a minimal copay. Sometimes there's no charge. Sometimes there's a lot that you're asked to pay based on your prescription drug plan, especially if you have what's called a high deductible health plan, which is becoming very, very common. And for some of our patients, you may not have insurance. You may be uninsured. And in that case, you also have a decision to make. And whether you have a coupon or not, that you will have to pay the full price unless you have some kind of discount. So this company is a generic drug company that offers you prescription drugs at the moment only online. And you can purchase one of, if a drug that you need is available on their website that you're showing, you could purchase it directly from them. So we tried to analyze a small sample of the drugs that they sell. We looked at 89 drugs that they were selling. This was back in February that we looked at this, and they launched this company in January. You may have heard about it in the news. It's been making a lot of headlines. And we found that Medicare, the insurance payer for our senior citizens and our disabled individuals, they could have saved about $3 billion. The insurance, Medicare.
What? Because I want to repeat that number again. How much?
Yeah. This is estimated over $3 billion. Yeah, just Medicare itself could have saved that amount of money if they had bought 77 or so of the generic drugs at the prices that the Mark Cuban company sells them. So it was pretty, surprising finding. And it goes to show that even though generic drugs are much cheaper than brand name medicines, which are, the ones that really people struggle to afford, there is still problems with how we're paying for these drugs. And there's a lot of opportunity for savings for Medicare, and even sometimes for patients, especially those who are uninsured or those who have are responsible for a lot of out-of-pocket costs, or what we call underinsured.
Then we have a lot of history, because a lot of the healthcare systems will build upon good faith. I do believe that everything starts with good faith, and I'm hearing that there's a lot of partners on this process, from actually the creation of the medication to actually delivering the medication, actually the patient actually buying it or receiving it and actually using it. Then there's a lot of pass-through persons over there. What do you think that it's the thing that it's different right now with the proposed Mark Cuban online pharmacy?
Yeah, you brought up an excellent point, and I think you hit it right on the head, which is, what this company does is they directly buy the prescription drugs from the drug company, from the manufacturer, as we call it, and then they sell it directly to patients. And they don't deal with any of the supply chain actors. That's the wholesalers. You may have heard of pharmacy benefit managers, insurance companies. They don't accept insurance. So they kind of cut out all of the supply chain and they directly sell it to you. And that has some benefits, because some of the drugs are much, much cheaper, but it also has some downsides, which is that whatever you pay out of pocket, that will not count towards your deductible or your annual out of pocket limit for your insurance company. At least not right now, because they don't take insurance. So that is a trade-off that you have to make. But it really depends on the medicine that you need and how much you're asked to pay. And it may be cheaper here.
I hear you completely. And, I was looking at the website, at least with the stuff that they are putting here. They have here some numbers. Then if, that's just mind-blowing. If we could improve that cycle of wellness, and at the end of the day, maybe with the insurance you're not paying it directly, but we as a society, we end up paying for all this stuff. And if something, I don't know your feeling, but after COVID-19, we are all very well, at least we're more in tune with our wellness and health. Then imagine having $3 billion to help nutrition programs for kids with obesity. That's something that it's the new epidemic that we're fighting right now, or mental health, or right now, overdose. And it's a lot of money that can be used to do a lot of good stuff in our community if it's actually well spent and distributed. And thank you for that. And what's on the pipeline? Right now you created this article that it's just amazing, and I'm going to showcase it right now again. What do you think that we need to move? Do we need to move towards? And I know that it's an ample question, but do we need to go with this type of systems? Is there any other innovation or policies that we can act as a society to improve what's happening right now?
Yeah. Well, you're totally right that whenever we spend money in one area, it takes away from how much we can spend in other areas. And I think there's a couple things to note here. One is that this company right now is offering specifically generic drugs. And when it comes to what affects our patients, our loved ones the most for expensive prescription drugs, it's almost always the brand name drugs that are the biggest problem. That's the cancer medicines, the infusions, some medicines for autoimmune conditions from the rheumatology department. Those types of medicines are the types of ones that cost the most right now. And those are not available through this company because they don't sell any brand name drugs. So when it comes to, when you ask, like, what is next? What can we do? Well, I think there's two different sets of things that are really important to keep in mind. One is that for the generic drugs, that this company has helped us to better understand some things when it comes to price transparency. Like you mentioned on the website, they really show you the cost of everything. They show you the cost they buy it. They add their 15% margin. Then they charge you $3 for the pharmacy dispensing fee, and they charge you $5 for shipping. And they're making it very clear. And that is powerful when we know exactly how much something costs. But it's also illustrating that there's a lot of problems in the supply chain. So I think one thing that we need to do is we really need to better understand what is going on with the supply chain. There are some very powerful companies that are taking advantage of that. And there's actually some ongoing investigations that the government is engaging in, try and better understand the anti-competitive behaviors that are happening. So I think that it's going to be very interesting to see what comes from those investigations. And also the new legislation hopefully comes that limits how much companies can charge for distribution. Because, we know it costs something to make the drug, and any kind of service you get a t-shirt, you pick up some food, there's some cost of the supplies to get from point A to point B. And that's normal. But when you're getting charged a lot more and there's a lot of people taking money, that's a problem. So I think that's one area that hopefully we'll see progress. And the other area we have to keep in mind is the really expensive brand name drugs. They have a totally different set of problems. Yes, they do have to be supplied as well. And there is a portion of those costs that are high because of the supply costs. But the bigger issue for those drugs is those drugs, they are monopolies. The company can sell it at whatever price it wants to sell it at. That's what we say in the United States. You get a patent, you sell it at whatever you want to sell it. We're not going to negotiate with you. And I think that has to change. We really need to have sensible pricing so that drugs are affordable. Because like for my patient who needs a really expensive blood thinner or a really expensive diabetes medicine, when they're asked to pay like $500 a month or $1,000 a month, they just don't get it. And then they don't get any benefits. And we have to find other alternatives. And sometimes those other alternatives are not as good. So I think I know it's complicated, but we need to address both the brand name drug problem and the generic drug problem.
Dr. Lalani, we're getting close to our closing remarks. Right now that we hear that, there's light, there's opportunities. We are actually for the first time understanding where are the barriers, the potholes, and most importantly, the solutions. We're talking in this audience to doctors, leaders, policymakers. What would be your wish list for them? What do you think that they should be putting their hearts and efforts in order to close this gap in the next following minute?
Yeah, I think we should make all the prices transparent so everybody knows what these drugs cost. I can go to a grocery store and I know exactly how much I'm going to pay for a banana, but I have no idea how much I'm going to pay for many of these drugs. And that's one thing. And I think we need to fix the market, the drug market, because there needs to be a healthy market where we can negotiate prices and allow the competitors to compete instead of just saying we're going to pay whatever it is. And that includes allowing Medicare to negotiate drug prices. And I think that also means that we need to prevent a lot of these anti-competitive behaviors. I know we are running out of time, but there's a lot of nuanced policy changes that can happen to really help patients access affordable medicines. And we need to stop letting the drug companies bully us around and really put patients first.
Thank you so much. A couple of things that are bouncing in my brain. Before I'm going to close, don't run away, Dr. Lalani. I will be closing after with you. But familia, one of the things that I'm learning right now with Dr. Lalani is that $3 billion is not small change. It's actually money that we can all be doing something else. And I'm not sending you to a cruise vacation or anything like that, but I'm actually talking about the obesity epidemic that we're having in our youth, the mental health challenges that we are all having, and most importantly, the future of this healthcare system. If we don't start actually uniting and putting innovative ideas like the one that Dr. Lalani is actually sharing, and making sure that we're honest with this, and then how can we plug and actually deconstruct the current healthcare system. Sadly, our kids, and maybe when we are older, this is not the healthcare system that we want to be part of. Then, as always, thank you so much, Dr. Lalani, for joining us. I'm going to leave at the end the website. That way you can take a last peek of Dr. Lalani's and his partners' article regarding how they did it, what they measured, and most importantly, what's the difference for us and why we should care. Again, this is Dr. Ilan Shapiro. I'm the medical director for health and other stuff here in AltaMed, including being the chief health correspondent and medical affairs officer. Please do send us your questions. This is an ongoing conversation. If you have other articles or other things that you need to showcase, let us know. We are here completely to uplift and most importantly, to vaccinate our community against fear with a dose of truth. Then have a beautiful day.